joins us. Good evening, sir.
Thank you, Greta. Thank you for having me back.
Nice to have you. Well, she'll be testifying apparently in the House of Representatives, but your thought on Secretary Sebelius, they've been trying to get her to testify for some time.
It's really time for her to take a stand and explain to the American people how this disaster could be so bad. It's as if she spent all of her time looking for ways to market Obamacare, asking companies, health insurance companies, to participate in spending money to market Obamacare, and yet we didn't have enough time focusing on how to get the opportunity to apply for Obamacare online. Listen, the iPhone cost $150 million to produce something. We spent over $400 million for a website that doesn't work. And you can't say there's a glitch. We need to ask some very specific questions and very simple questions. What's wrong? How do you fix it? How long will it take? We're talking about 1/6 of the economy now being in the hands of folks who spent $400 million simply for a website that doesn't work.
Well, she just released a press release a few moments ago in which she admits that it has been, in her words, rocky, that has been rocky start, but that they're working tirelessly to make it better. But here's the question. I mean, glitches can be fixed. How do we know that this is not just, that these aren't flaws? I mean, flaws are a little bigger problem than glitches.
Well, I think the word glitches was poll tested to make sure that people were comfortable with that thought process. The reality of it is this is an absolute failure. You don't spend $400 million on a website that people, no matter how many are trying to log on, you should be able to log on. We have hundreds of thousands of experts in Silicon Valley and across this nation who spend their time building websites. We ought to hire experts to build websites. And this is just another example of how challenging it really is when you turn something over to the government that could be better done in the private sector. This is why it costs so much, why it doesn't work very well. My great fear, however, is this is just a website. We haven't started having a conversation about the provision of health care, about paying claims, about making sure that all the pieces fit together. After 15 years in the insurance industry, I will tell you that the reality of it is this, if it's hard on the front end, it's going to be really painful when we get to pain of having to take care of claims, having to take care of people. This is a real challenge, and if it's this bad now, I fear the worst is still to come.
Today, the President spoke from the White House, and he said that many politicians, and he was referring to those in the Republican Party, are rooting for failure. Are you rooting for failure of Obamacare?
I don't think anyone has to root for failure of Obamacare. Obamacare is consistently and currently failing. What we should root for is private sector opportunities to improve the health care delivery, to make health insurance more affordable. It's one of the things that you've asked several times in your show. What's the alternative? I'd love to have a serious conversation about how do we solve the problem of having more access to health insurance without giving it to the government. We see today why giving it to the government costs more and you get lower qualities when that happens. I think we could solve the problem far better in the private sector by allowing 3 or 4 basic principles to guide us in the direction of a private sector solution.
All right. Let's say that the online system gets up and running, the phone system works as well to register people. At that point, and you say that the Obamacare is going to fail, but do you want it to fail?
No, well, what I want to happen is I want more Americans to have more access to health insurance. I do not believe Obamacare does that. Here's the numbers that stick in my mind. According to most experts, by the year 2023, 10% of Americans will still be without insurance. We'll spend $3 trillion getting there. Today, 15% of Americans are without insurance. So the question is it really worth $3 trillion to provide health insurance for 5% of the people, or is there a better, more cost-effective way to make sure that people have access to health insurance without going through the government? I think the answer is yes. A couple things that we should keep in mind. The cost was $900 billion just in 2009. The estimates today go in excess of $3 trillion by some experts. So,
which brings me to the question that one of the things that was battled about in the last week is the income verification to figure out who getting Obamacare should have a subsidy from the federal government. As the subsidies go up, of course, that's a greater cost of Obamacare. And yet, if we can't even figure out how to enroll people in the program, what level of confidence can we have that we have this income verification so we know the people who should get subsidies get them and those who should not do not?
That's a great question. I think it brings into question also everything from the navigators to the IRS. We have a lot of serious questions that Ms. Sebelius needs to answer, because if, at the end of the day, if we're going to ask the IRS to be in charge of the back end, the question is how do we do income verification accurately at the front end, and then take into consideration the fact that these folks that we're going to verify their income, once we see the employer mandate kick in, the 40-hour work week for many employees will be gone, and they'll be down to 30 hours, maybe 29 hours. And so we're having a brand new conversation a year from now about how the implementation has to be once again kick-started because of the new rules and the new opportunities that are coming their way after the end of the first one-year delay of the employer mandate. So piecemealing this bill together over the next several months and over the next year or two is not going to be a great way for the American people to feel comfortable with a brand new entitlement that we both know is going to be very difficult to afford. And we haven't started talking about the fact that it adds $6 trillion to our debt.